Welcome to the National Organization of Nurse Practitioner Faculties podcast.
Welcome to the second series of the NONPF podcast, created by the Simulation Committee of NONPF. This year, our podcast series, titled In the Trenches, Confessions and Pearls of NP Simulationists, will center around the 2023 fall release of the NONPF Guide to Nurse Practitioner Simulations, a step-by-step approach. This guide, an e-learning book, was created by the NONPF Simulation Committee. The ebook is formatted to help NP faculty design effective, measurable simulations that address learner programmatic and national level competencies. Led by members of the current Simulation Committee, podcast moderators invite authors of the ebook to share pearls of approaching simulation from the perspective of the nurse practitioner. Hi, and thank you for joining us today. This is the next podcast in our series of the NONPF Guide to Nurse Practitioner Simulation, a step-by-step approach. My name is Jeannie O'Rourke, and I'm going to serve as the co-moderator for today's podcast. I am an associate professor at Loyola University in Chicago and a happy member of the NONPF Simulation Committee who gets to do this fun work in our free time. So I'm going to introduce my co-moderator today, Dr. Queen Henry-Okafor. And would you like to introduce yourself, Queen?
Yes, thank you, Jeannie. My name is Queen Henry-Okafor. I'm an assistant professor of nursing at Vanderbilt University, and I truly love being a part of the NONPF Simulation Committee. And welcome.
Thank you. And now our two phenomenal guest speakers today, who I've had the pleasure of knowing for several years now, working with on the NONPF Simulation Committee. Dr. Kelly Casler and Dr. Carla Nye, and they're both authors, the primary authors of the ebook chapter titled Outcomes and Objectives. So Kelly and Carla, would you like to briefly introduce yourselves?
Sure. So, hi, everyone. My name is Kelly Casler. I'm an associate clinical professor at The Ohio State University College of Nursing. And I've been on the NONPF Simulation Committee for, I think, about 3 years. I echo what everyone says, that it's a really great group to work with. And I've been doing simulation for most of my career as a nursing educator.
Great.
Hey, hi, and I'm Dr. Carla Nye. I'm a clinical professor at Virginia Commonwealth University. And like Kelly, I've been involved in simulation, both graduate and undergraduate, for a long time. Been a member of the NONPF Sim Committee since 2019. So really excited to be here and to be a part of this project.
Yes, thank you so much. So our goal today is just to kind of give a tickler of this chapter. And I'm just going to confess my nerdiness here for a second. And my love of objectives and outcomes, because we know in nursing education and in simulation, if we don't start with well-crafted outcomes and objectives, then really what's the point? And so this is a fun chapter for me to get to co-moderate and ask some questions. So I'm going to turn it over to my co-moderator, Queen, to ask our first question.
Thank you. Could you start off by briefly going over the 4 steps that you include as key to developing outcomes and objectives for a simulator?
Sure. Oh, go ahead, Carla. Go ahead.
Oh, we're both ready to go. I don't know. You go ahead, Kelly.
Okay. Yeah, we kind of in this chapter broke it down to 4 steps to make it, kind of an easier concept. And really it starts with a needs assessment, which is where actually our ebook, I think, starts out of how to do those needs assessment. But, most of us come up with ideas for simulation anyway, because we are doing, we're constantly assessing the needs of our program. But that's the first one, is to conduct that needs assessment. And then step 2 would be to think about those needs and then think about how you want your students to perform and what the outcome is that you want them to meet. And we usually align those outcomes according to Kirkpatrick's model. And usually we're looking for some kind of outcome that is in the knowledge or the behavior realm. And then step 3 is going to be to write the objectives that are specific to the simulation, what's specifically going to be done during the simulation. And then finally, step 4 is to think about how you're going to share the outcome and the objectives with the participants as part of your pre-brief. I don't know, Carla, you may have something more to add, but that's kind of the overarching steps there.
I think you probably said the literally exact same words I was going to say, but I'm thinking about putting this into the perspective that our listeners can get into. How often if we said, I want to do a simulation on asthma. I love asthma, and asthma is what I want to do a simulation on, when maybe all of your students see asthma patients in the clinic and it's not something, it's a very common thing that they're seeing, and that might not be the direction. So that needs assessment that Kelly talked about is so valuable to really think through, what is it that my students need? What are the content or the knowledge or the skills or the attitudes or attributes that we really want them to be able to demonstrate for us. And then tying your objectives, as Kelly just said, to that, instead of everybody gets asthma. Not that there's anything wrong with asthma.
But I'm going to piggyback from there, right? So it's almost like we need to start with the end in mind. So you start with, what are your outcomes? And that drives then your simulation topic and your objectives for that simulation. So can you talk a little bit about, and a lot of people, I think, miss that gap, right? You start with the end in mind. That's just a philosophy that I use. Can you talk a little bit about, from the chapter's perspective, how the objectives then drive the selection of a specific simulation, a specific modality? So the outcomes are at the end, the objectives are at the beginning, but how do you then merge them and then drive the selection of simulation? If that makes sense.
It's Kelly and I are both waiting for each other to speak here because
I was just thinking that.
I know. We should always let. So my big thing about this is, it really again stems back to step 1, which is the needs assessment. So if you're talking to your preceptors and you're talking to your clinical faculty and you're finding that the student groups say maybe you're really struggling with one thing, and I'm just picking a topic. Let's say it's being able to present their patient to their preceptors in an organized fashion with just that right amount of information, then your outcome at the end your objective and your outcome would relate to being able to present a patient case in a concise and complete manner. So that's the behavior that you're looking for. And so it's included in both your objective, and then your outcome would be based on addressing that. And I picked one. Kelly's, I'm sure, has others to exemplify.
Yeah, one that easily comes to mind for me is we had noticed several years back in our curriculum that our students in clinical, although they were getting good PEDS experience, a lot of it was acute problem PEDS experience, and they weren't getting, not all of our students were getting much well child check type experience. So that really is an example of how a needs assessment for us drove what ended up being called our well child simulation. So our outcome really became that we wanted our students to be able to perform all aspects of a well child visit with minimal assistance, of course, by the time that they graduate. And that drove our objectives of, we came up with objectives of, we're going to have the students over the course of 2 hours see 4 pediatric patients and practice not only collecting the history and doing the exam, but we wanted them to practice the anticipatory guidance aspects of the well child and also be able to practice the giving screening recommendations and things of that nature. So when we looked at that as kind of objectives of our simulation and what the outcome was, we realized that, okay, we're going to need standardized patients, like a family dyad of child and either parent or guardian. So that's a little bit of an example of how that kind of all flows together to inform how you develop your simulation.
And one of the pieces that we have in the book is that connection between, we're doing things for a reason, right? There needs to be a reason for doing the simulation that you're doing, and it needs to address a student learning need, whether it's a knowledge, skills, or attitude. But it also needs to tie to the course objectives. It needs to tie to the programmatic objectives and honestly into the nurse practitioner core competencies. It shouldn't be something that's out of the blue. It needs to be connected with how we are, I would say, encouraged, how our education is supposed to be built. And so that's the other big piece, is it shouldn't be something that's out of the blue. It should be tied beautifully with NONPF core competencies, course objectives, and then the simulation objectives.
That you talked about doing things for a reason. So I know both of you are experienced in doing simulations, and you would have seen a lot of poorly developed objectives and objectives that are well done. So could you speak to someone who is a novice in preparing simulations as to what they need to do in terms of developing clearly stated objectives?
Yeah, I think probably the most important thing is find a friend that maybe has done it a little bit longer than you. We do know that we have a lot of new faces in academia, but hopefully people know that they can reach out to their colleagues in NONPF as well if they're really struggling. But I think doing it with a colleague and doing it in a structured format. In the chapter, we list out the SMART mnemonic for writing objectives, so that you're going through it in a very systematic manner. I think that tends to make it easier as well. And if you have two sets of eyes looking at it rather than one, that tends to, you catch things that each other miss.
I love that. I think simulation is not an individual sport. It very much is a team effort. One of the things we talk about in a previous chapter is that simulation team is creating a simulation with a group where you have your standardized patient, your standardized patient expert, your operations person, your content expert, and your simulation expert. And it really is so much more fun to do it than to feel all that pressure on your shoulder, to be able to bat ideas around and as Kelly just said, build each other up in terms of building your objectives. I was trying to, Queen, I think I was going to give a very general answer. I just remember my early times just starting out and writing objectives, and this is back in the dark ages. We tended to use a lot of similar objectives for all sims. So there was always a communication sim. There was always a physical assessment sim. They were very generic, though. And when you get to very generic, it doesn't help in the evaluation piece. Because when you're talking about the evaluation, which is another chapter that will be coming up, you want to have specific concepts and behaviors that you're looking for. And you'll see in our objectives chapter that we have built out kind of what is happening in the sim that should elicit the type of behavior that you're trying to be able to evaluate. So it's this entire picture of the simulation. So the really generic objectives don't really help people to understand specifically about this sim where to go. So that SMART objectives that Kelly was talking about is much more helpful.
This is outstanding. Thank you, Dr. Nye and Dr. Casler, and thank you for listening. This is just a little bit of a teaser. If you get the book and look at and read it, you'll have a lot more tools to help you with developing your simulations, and your students will be better off for it. Thank you again for your time.
Thank you, Queen.
Thanks for having us.
Thank you. It's a pleasure.
Thank you for joining us today to hear from our NONPF simulation experts. This podcast has been written, directed, and produced by David House, Jeannie O'Rourke, Elaine Kauschinger, Tedra Smith, Jeannie Rodriguez, Leanne Barfield, and Queen Henry-Okafor. Special thanks to NONPF CEO Mary Beth Bigley. The digital ebook is available for purchase on the NONPF website to both members and non-members. The opinions expressed in this podcast series or any product mentioned are not specifically endorsed by NONPF.